Okay, very important. Firstly, I'd like to thank Dr. Hidal and Dr. Malik because both of them are contributed with me in this study. Uh, Very important also to know what is the prevalence or what is the importance of the prevalence study. Prevalence is useful to estimate the burden of disease. That will help to understand the demand and the demand health to manage this disease through the country or regions. My study is like a systematic review, meta-analysis to know the estimation of diabetic retinopathy among patients with diabetes in GCC countries. I address my topic in this agenda, background, clinical science, GCC countries figures, diabetic retinopathy figures, research problems and objectives, methodology and results, discussion and conclusion. As a background, diabetes mellitus is a metabolic disease that develops in the body because of reduced insulin activity or insulin production. One of these problems or both together will lead to diabetes mellitus, as you know. The body eventually experiences pathological change. This change, like neuropathy in the eye, and neuropathy generally, or retinopathy in the retina, and cardiovascular problems. Also, you can find some change in the eye, like cataract change. Cataract change, we know it comes with the age, but in these cases, you will find it maybe come earlier. Okay, and again, also you can find some problem related to the cornea. Among this consequence or among this change, you will find diabetic retinopathy, and it is according to the epidemiology and studies global, you will find this change is a leading cause of visual impairment in working age individuals. That means in very important age for the humans. Diabetic retinopathy also caused by progressive damage to the retina structure due to visual injury and formation of blood vessels in response to long-term high blood sugar. Firstly, structure will affect and will be injured. Then after that, blood vessels will come as a new, which is called neovascularization. If you look for this photo, you will find the clinical signs starting from mini or small, minor signs like microaneurysm, and which is the first signs. And if you look for the photo, you will find like this in the retina, if you use ophthalmoscope or fundus camera. And also you will find exudates. In some cases, you will find hemorrhage and minimal intraretinal microvascular abnormalities in moderate level. In the advanced level, you will find new vascularizations. That means the retina start to build new capillaries. In GCC, the most common being type, according to the studies, is type 2 of diabetes mellitus or mellitus, representing around 8 to 22 from working age of population. And here, that means this percentage exclude the age after hiring. That means we'll speak about the working age. 9% global estimation. The highest here is higher than the global estimation. Also, several studies indicated high range of diabetes mellitus in prevalence in the GCC countries, such as Saudi Arabia, 32.8, and 16.3 in United Arab Emirates. According to diabetic retinopathy figures or numbers, you will find it globally around 27%. That means 27% out of diabetes patients, which led to 0.4 or 400,000 blind people because of this disease. Saudi Arabia showed in systematic review conducted in Saudi Arabia in last years, high estimation of this change or this disease is like between 6.25 to 88.1, which is higher compared with estimation, with global estimation. Research problem and objective. This systematic epidemiologic data is vital from health legalizations in GCC countries to implement early and effective interventions. As I said in the beginning, the prevalence will help in the help decision makers to decide, and will help in also to build the management plan for to control this disease or this change, or to manage. As far we know, there is no study has evaluated this prevalence in diabetic retinopathy in these specific regions, I mean here GCC countries, and also to estimate the proportion of diabetic retinopathy in diabetic patient in the GCC countries. Methodology that used in this study, we used, as we said, PRISMA, which is preferred reporting item for systematic review and meta-analysis, called PRISMA, which is conducted in 2020. We use their guidelines, okay, and then we start to identify the studies, and then after that we did screening, okay, and then we did eligibility, and then after that include the study which is meet our criteria, inclusion criteria. We use web peer-reviewed English language between 2003 to 2023, and we use this data set or the database, Web of Science, Scopus, PubMed, Google Scholars, and ProQuest, and Medline. Also, we used Boolean operators and or to see prevalence, epidemiology, distribution, rate, because you will find in the title will not mention sometimes prevalence, sometimes epidemiology, sometimes distributions. According to that, we use this this prevalence. Sometimes we use epidemiology, and we use it country by country, because the study comes in the name of the country. Selection criteria, population-based and cross-sectional studies that will not include the review study, will not include case studies. We'll use just based population or population-based or cross-sectional studies. Another inclusion criteria, prevalence of retinopathy among patients with diabetes and with that conducted in GCC countries. That means not out of these regions. Article using secondary data were excluded from the analysis. We use primary data or article which include primary data. And for example, we have secondary data for a study conducted in Oman 2020. We excluded because it is secondary data. Extraction for our data, we prepared Excel sheet. This Excel sheet include the columns. Columns include the data we need, starting from a name of authors and the year and country and sample size and prevalence. I mean here the prevalence which enumerate or detected by the researchers, not by us. Because again, we will do meta-analysis to see the prevalence and to see the proportion. This prevalence mentioned here related to the researcher of studies. Frequency of retinopathy and mean of participant, age, duration of diabetes, and prevalence in gender, because this is the risk factors related to the diabetes patient. Also, we analyze or we see the magnitude of proliferative and non-proliferative diabetic retinopathy. Then we do the meta-analysis. The meta-analysis we use here the MidCalc version 19.6.1 software. Okay, and we check the heterogeneity among the studies, because this is very important to study or to do systematic meta-analysis, because the community is not same. For that, you need to measure the heterogeneity. Prevalence of diabetic retinopathy among patients with diabetes, we check it by the proportion, and we examine the overall proportion, that means for all the studies, and the p-value we used here is 0.05 and determined statistically as a significance. The analysis of our results, firstly, this is the details of a study. That means this is the data as raw data from the studies, and we create it like that in the Excel sheet. We give them the author years and these studies as appear in this table if it is appear for you. Secondly, we need to do some highlights. We have 20 articles and 61,085 subjects, and the number or the size of subject is starting from 92 in some studies to 50. That means big subject in this study. And 8 studies, 40% investigated prevalence of diabetes in individual with type 2. That means not type 1. The remaining is discussed, all the remaining 60% discussed type 1 and type 2 in the same time. But there is 40 discussed the type 2 diabetes. The duration of diabetes was found to range between 8.6 to plus minus 5.96 to 13.4 plus minus 8.24 years. Okay. This is the analysis of the data. Okay. If you look at the pooled prevalence of diabetic retinopathy was found to be around 20.53, and 60%, that means 12, higher than the pooled prevalence. That means if we have 20 study, 12 of this 20 study is more than the estimation. So the patient is highest. We found some study 69.75. United Arab Emirates is less. We found study around 6%. High significant degree of heterogeneity. We found this study, and it is significant. If you look for the p-value, you will find it p.0001, and the heterogeneity you will find it around 97.99. The result also show, if you look here, you will find the highest non-proliferative diabetic retinopathy in Saudi patient, which is in the study 2016 conducted by Ahmed and others. And again, you will find also Rubian found the lowest again in Saudi Arabia, which is 9.1, and in the proliferative diabetic retinopathy, you will find the highest is 8.6, and it is in Saudi patient also. In the discussion of this result, the highest estimate of diabetic retinopathy was found among Saudi patients, whereas significantly lowest also found in United Arab Emirates patients. The pooled prevalence of diabetic retinopathy in this review was comparable to estimation reported by Rubian. And I think because the sample size of a Rubian study is higher, which is 50,000 compared with the total sample 1,061 point something. Some countries, such as Saudi Arabia, showed variation in the prevalence of diabetic retinopathy. You'll find some studies speak about 69.75, some studies speak about 36.41, some studies speak about 17.79%. Our finding also lower than the global estimation, which is 25.2, according to the IDF, International Diabetes Federations, which is conducted in 2019, and the 22 also conducted in other studies, also a little bit higher than our studies. Also, Mediterranean estimation, also it is higher than our studies. Our study is higher than the Southern Asia with 16.99 and South and Central America 13.37. It has been observed that GCC country exhibits some of highest risk factors globally with regards to lifestyle disease, particularly diabetes mellitus. Some of included studies showed that duration of diabetes is one of the important diabetic retinopathy risk factors, and this agrees with other studies because this change will not happen in the first year of diabetes. will appear after some years. Okay, for that you will find that there is a relationship or the strong relationship between the duration and the diabetic retinopathy stage. As a conclusion for this study, this study represents the first comprehensive analysis of prevalence diabetic retinopathy in Gulf Cooperation Council, GCC, and the data are derived from 20 studies involving approximately 6185 participants, with the diabetes indicates a prevalence 20.53 of diabetic retinopathy in the region. This finding underscores the significance of diabetes screening, regular eye examination for retinopathy, effective diabetes management, and control of risk factors. Our research provides crucial information for health system in this region because to decrease the controllable risk factors. That means to do cure or to do something to decrease the progress of diabetic retinopathy, and to identify diagnose diabetes through the screening, and to put that screening as a regular screening for all diabetes patients and early stage of retinopathy. And this will provide a suitable diabetes care to reduce the number of untreated cases. That's all from my side. Thank you for following me, and the air with you, Ms. Ferdina.
Thank you so much for your presentation. Participants, if you have any questions, you may raise your hand or put your questions in the chat box or in the question answer session. So, Dr. Sulfigar, I have a question for you. How is the quality of life among the diabetic retinopathic patients?
Okay, thank you for this good question. And it is, I think the question is about the quality of life is a comprehensive question, because as we know, the vision is very important for humans, okay? And diabetic retinopathy and diabetes directly lead to change in the retina, which is, as I said, diabetic retinopathy. This will lead to reduce the visual acuity, firstly. For that, you will find the visual acuity of those patients is reduced. And as I said, mentioned in the background, it is one of the leading cause of the blindness and visual impairment. For that, you will find those people by the time will be like a low vision, okay? And the quality of life will reduce. That means those people difficult to achieve their tasks, difficult to do their activities, okay? And you will find them then after that they reduce social activities, personal activities, like that. Another thing, and it is very important for us in Buraimi here, now we already start to do like a study to know the effect of diabetic retinopathy on the quality of life of patient in Buraimi Governorate. This study was conducted as internal grant by University of Buraimi. Thank you.
Okay, thank you. Appreciating your research works in the future as well. So, as we all know, diabetic retinopathic patients will have a lot of visual impairment, and it will affect their normal function. And thank you so much, Dr. Sulfigar, for your presentations.
Thank
And
you.
there's a
There is
question here. Yeah, there is a
Can you read?
question. Yeah. There is a question. Any differences is there between patient controlled blood sugar and patients not controlled blood sugar in developing retinopathy?
Thank you for this good question, Jamal. Yeah,
It is a
for
question
that,
from Mr. Jamal.
yeah, there is relationship for sure. For that, we said there is risk factors, and we said very important to do screening for the patient. This because if you did screening, that means you know the level of the disease that will lead to control the sugar. If the sugar controlled, you will find some people more than 70 years, and there is the level of diabetic retinopathy is very low. Okay, that means if the sugar control and the patient other risk factors like as we know, fatness and these things will lead to effect of diabetic retinopathy, and you will find them in good situation. You'll find so different patients, the visual acuity with of them after maybe 20 years of diabetes, their visual acuity is 6.6. For that, the control sugar is good and will lead to will not say stop, but will lead to reduce the progression of diabetic retinopathy.